I'm Dr. Elaine Tong, and I'm here today with our patient, Don. How are you doing today, Don?
Pretty good now.
Don just came for a treatment, and we're going to talk about what he's been suffering from before actually he even came to see us. When was it you first came to see us?
About 4 years ago.
4 years ago?
Yes.
Okay, and what were you suffering from?
My right leg was, circulation was so bad that my leg was as black as my shoes, and it was close to gangrene. It was about ready. I knew it was ready to be cut off, and so I was driving around on a Saturday, and I heard your show on the radio, and it was just like, God telling me this is going to help you, and so I called right away. We made an appointment. I came in, and your dad started treating me, and it was just a miracle. You returned my leg to normal.
So before you had your first treatment with Dr. Tong, my father, your right leg was completely black.
Yes, all the way up.
Down.
Yeah, from the calf
down.
The top of the calf down,
so,
and it was swollen like a 50-gallon drum.
Okay.
And
what did your doctors want to do for it?
Oh, the Western doctors, they just said, "Oh yeah, that's bad," or
really?
keep your leg up, and that's about it.
Okay.
And that was the only thing they offered.
And now, before that happened, was your leg normal, or did you see it gradually getting worse and worse?
No, I gradually started seeing it get worse.
Get worse and worse. So, Don, you have a history of diabetes as well?
Yes, it runs in my dad's side of the family, and I caught the diabetes when I was 50, and I'm almost 65 right now.
So, for 15 years you've had diabetes.
Right.
Also high blood pressure, is that right?
Yes, I've had that too.
Okay. So you're taking medication for all of this?
Yes.
Okay. And now your legs for the past, so 4 years ago, you almost had to have it amputated. How many treatments did my father give you before you noticed an improvement?
Oh, it started draining the lymph out of it immediately, and he was treating me like twice a week for maybe 4 weeks, and within a month and a half, it was pretty close to normal by that time.
So it wasn't black anymore?
No, he restored the color, leg turned out,
And you haven't had, and you had no amputation?
No,
obviously.
thank God. Thank God I still got my legs.
Okay. So now you've been here coming for treatments for about 4 years.
Yes.
Pretty consistently. Tell us about what you've been, even the last year, what you've been suffering from.
Well, he brought my leg back to normal, and then I didn't see him for about 6 months. And through bad eating habits, the thing developed again. Not as severe because I came back a lot sooner.
Okay.
And so there's been times I've been off for like 6 months or so, falling back to my bad eating habits, and it's started to recur. But I'm trying to maintain the treatment right now and everything, and it's doing well.
Okay. So now when you got your new job, then tell us about that, and tell us why you keep coming back to get treatments from us.
I keep it to maintain my health, and it helps give me energy. Also.
How are your legs now?
Right now, they're real good. I came in here, it's a little bit swollen today, but I've been drinking too much coffee, and but the pressure's relieved already.
And I just treated you.
Yeah, you just treated me.
Okay, so Don, what else have we treated for you besides your swollen legs from your diabetes?
Well, like today, you treated me for the flu, and I could barely talk when I came in here, and now I can talk better. And my cough has gone away already.
Okay, so how long were you sick before you came to see me today?
About a week.
1 week?
Yeah.
Okay.
But the cough was real deep in my chest. I was afraid it was going to turn to walking pneumonia. Yeah.
So after the treatment, how did you feel?
Well, my chest just feels cleared up now. The throat's getting better.
Okay.
Yeah. So the release is immediate.
Okay. All right. And how many times have I treated you for the flu?
This is the second time.
Second time.
Yeah.
The first time also.
It cleared up right away.
Right away.
Yeah.
Okay. What else do we he treat you for besides that then too?
I've had tendonitis in my elbows. I carry a 10-pound panama in my left hand, so it gets really strained here.
Okay. And does does your regular doctor do anything for that, the tendonitis?
Oh, he'll give me ibuprofen.
Okay. And when I treat the tendonitis in your elbow, how do you feel? What do you get relief, or how do you feel?
Yes, it takes the fire out of it. You know, the burning pain.
And how long does that take to relieve after I treat you?
By the time I get out of the office.
The burning pain is gone.
Yeah.
Excellent. This sounds so amazing.
Well, it is. I mean, you have to experience it. The treatment is like electrical shocks, you know.
What else?
But you can immediately, after the little shock, you feel the tension release.
Mm-hmm. And you said you were talking about knees before. You had some knee problems.
Yeah, I was having a little restricted movement in my knees, and after the treatment, then I was able to function normally again.
Okay, that's wonderful. Now, another point I'd like to make is that you've been coming for treatments pretty regularly now, and you get better, and then you get worse, you get better, and you get worse. What do you think you do that causes you to get worse again? Or
Well,
do you know?
mainly my diet.
Okay. And what have we been working on to get your diet better? What have we been talking about?
About the categories of food, whether it's hot, cold, or warm.
Mm-hmm. And we're also having you drink the alkaline water now too. Is that helping?
Yes,
you?
that helps a lot.
What do you notice difference in your legs after you drink it?
There's less pain in there. You know,
Less
it's
pain.
not the tension in it.
Okay. All right. So, lastly, what is your typical day at work? Just so we know what you go through every day.
Well, I get up at about 3 in the morning. I drive an hour or so to work, and then I wait for the day to start. I kind of get things prepared for the work day, and I go up and down the stairs, 3 flights of stairs, in charge of 18 men, and I'm constantly moving all day, and then I face like an hour and a half, up to 2 hours driving home at night in the traffic, stop and go traffic. By the time I get home, it's like 5 o'clock or so, and my feet have not been elevated any of that time, and basically all my feet are driving, and it's just a long day.
So basically, you're on your feet 12 to 14 hours a day.
You're right.
Right. Okay. So finally, Don, where do you think you would be if you didn't have our treatments?
In a casket.
Oh, no, that's terrible. So,
Excuse me.
Oh my goodness.
Because my leg would turn black, be cut off,
And you're still taking regular medication from the Western doctor, from your regular doctor?
Yeah.
Okay. So basically, Don works 10 to 12 hours a day on his feet. He already has swollen legs, and it's hard for him to eat the diet that we recommend him because of the nature of his work. And that is why he comes back to get treatments from us regularly to maintain his health. So to summarize Don's case here, he's been seeing us for about 4 years, and he comes back, he gets relief, he gets very good help with his legs, the swelling is down, the infection, it's been infected a few times, is relieved, but he keeps coming back for treatment. So why is it? We say that our treatment can cure his problem, cure difficult diseases. Number one, his disease is difficult to cure because he's had it for a long time, number one. Number two, his job renders it's hard for him to find nutritious food to eat on a regular basis. He works in construction. Usually the food that's available there is junk food, chips, Coke. You do try to eat salads, but sometimes they're not available. So that's another thing, is his nutrition. So if he does not follow what we tell him to do, some of the work that we do on him is undone when he does not follow the right diet.